Pharmacogenomics is a field of research that studies how a person's genes affect their response to medications. Let's Get Checked, MyPGX, is a new offering for business clients. This robust testing panel identifies potential drug-gene interactions for over 100 drugs across behavioral health, cardiovascular health, and pain management. This accounts for over 800 million annual prescriptions in the United States alone. To learn more, visit letsgetchecked.com/mypgx. Let's Get Checked also provides access to testing, virtual consultations, and medication delivery for a range of health and wellness conditions from the comfort of home. Visit letsgetchecked.com to shop their health tests and use code DNA today for 20% off.
How is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, the genes of you and me, they're all made of DNA. We're all made of the same chemical DNA. We're all made of DNA.
Hi, you're listening to DNA Today, a podcast and radio show where we discover new advances in the world of genetics. From genetic technology like CRISPR to rare diseases to new research, we have you covered. For a decade, DNA Today has brought you the voices of leaders in genetics. I'm Keira Deneen. I'm a certified genetic counselor and your host. Joining me now is Dahlia Attia-King, founder and CEO of Panacea. Panacea's mission is to improve access and utilization to genetic testing by offering affordable whole exome sequencing, physician oversight, and genetic counseling. Get this, all in a 10-minute workflow. So we're going to explore this in this week's episode and focus on utilizing whole exome sequencing in the preventative health space. And from my memory, listeners, correct me if I'm wrong, I don't think we've actually explored it from that point of view. Usually we're approaching it with the diagnostic odyssey part. So Dahlia, before we jump into whole exome sequencing, I think we should just define and remind listeners what the difference between whole exome sequencing is and whole genome sequencing. So do you mind giving us a little background?
No, absolutely. Absolutely. So whole genome sequencing is the sequencing of all of your genetic material, all of your DNA. Whole exome sequencing is the sequencing of the specific regions of your DNA that code for genes. And the reason why this is so valuable in healthcare is because the vast majority of genetic conditions occur due to changes in the exome. Very few health-specific problems occur in the regions outside of the exome. And so when you're sort of analyzing the cost benefit of whole exome versus whole genome, it's very much in favor of whole exome. It just makes more sense from both the diagnostic and preventative perspectives.
It does. I think it makes sense, as you said, to really, if you're looking at it as we're going to be talking about in a preventative way of just learning about your genomics and how that may impact your health, doing a whole genome sequencing, yes, you're looking at a lot more data, but it's not necessarily as valuable data compared to the exome. Because as you were saying, like it's the active part of your genome. That's what actually ends up becoming proteins in different parts of your body. That's what's expressed, as we say.
Exactly.
Yeah. And a lot has changed in genetics. We started ordering with just single genes. We'd say, well, we think it, when we're looking at the diagnostic part or even preventative of saying, okay, someone in the family had breast cancer at a very young age, like maybe we should look at a BRCA mutation and look at, the two genes there. So I guess that wasn't the best example, two genes, but, single gene, two genes, whatever. And then we were like, okay, now we're moving towards panels and people don't order single gene as much. I don't hear about that the last few years. There's exceptions, but in general, usually, more panel. But in the last few years, we've even been moving towards this whole exome sequencing. Why look at whole exome and not panel? Why start with whole exome?
Yeah, that's a fantastic question. So there's a few reasons. First, as we just mentioned a few moments ago, whole exome is the most comprehensive, all-encompassing, essentially hereditary disease test available. It's literally sequencing all of your genes, so you're not missing anything. Panels, by design, only sequence a small, group of genes. So there's so much that's actually left out of panels. So because of that, people might actually need multiple panels in their lifetime. And because of that, there is so much redundancy and confusion in genetic testing with panels. Whole exome is just a one and done. It's really the only hereditary disease test you'll kind of have to take in your life. And secondly, whole exome raw data is really valuable because it can be stored and continually referenced against the latest, scientific discoveries, so that you never really miss out on information that pertains to your particular genetics. You can't really do that as comprehensively with panels because, again, so many of your genes are really left out of panels. You just don't have that much information to reference, just a few genes. So much is missed. And finally, and I think perhaps most importantly, the cost of whole exome has come down substantially because technology is improving and it's becoming more ubiquitous. And 5-10 years ago, whole exome sequencing was tens of thousands of dollars, and today the average whole exome test is about 8,800. And actually, at Panacea, testing, physician oversight, and genetic counseling is under $1,000.
Which is pretty
And
impressive. You're comparing it to $8,800 is the industry average in 2021. Yeah.
It is. We're so fortunate. We partner with incredible labs like Gene by Gene in Texas, who really share the same mission that we do. And that's essentially to improve access to quality, affordable whole exome sequencing. So I really do think that whole exome sequencing is truly the future of genetic testing.
And when we look at panels, that can change over time. So we look at like a hereditary cancer panel where, I was bringing up the BRCA example when I'm going through genetic counseling with people and saying, oh, did this relative have any genetic tests? They're like, yeah, they did like 15 years ago. And I'm like, okay, that time-wise, like it's important to know history of genetics because then you can figure out, well, what was available at the time. So I know that they didn't do a panel if it was like 15 years ago. So nowadays, if they do a panel, that's even going to be different if it was, say, 5 years ago, because we're adding more and more to a panel. Whereas when you do whole exome sequencing, what's included in an exome is not changing. That's going to be the same, and it has been the same. So I think that's another big difference, just to highlight a little bit more of what you were saying. And I want to pull out another part that you said that, Panacea, you're really focused on the accessibility of genetic testing. That's one of your goals and one of the things that fueled you. And you took years to understand the barriers in patients pursuing genetic testing and having access. I mean, we could do a whole episode in itself of just what you
literally
learned. So I guess like the highlights of what you learned in just doing that exploration as you were building Panacea and knowing what was really important for you to provide people.
Absolutely. And you're right. We could literally spend the whole episode talking about what we learned.
But
I'll just share like the overarching theme of what we learned. So there exists this incredible technology that we all are familiar with, right? Called next-gen sequencing. And it allows for genetic testing, which arguably revolutionizes how we understand human health.
Easily.
But despite this, 80%, up to 80% of people who need clinical genetic testing, these are people who fit current clinical criteria and guidelines, right? They're not getting tested. And my team and I, my partners and I, could not fathom why. We just couldn't wrap our brains around how and why this was a problem. So what we essentially did was dig in deep. And we looked in the places where no one was looking, and we asked the questions that no one was asking. And we literally spoke to anyone that would speak with us in the genetics and healthcare space. And here's what we discovered. There's 4 key stakeholders: insurance companies, doctors, labs, and patients. And all of these stakeholders are on completely different pages when it comes to genetic testing. All of these stakeholders are incentivized completely differently. So this end goal of people getting tested was literally just not happening because none of these guys and gals were aligned in this goal. So when we began kind of understanding what makes these stakeholders tick and what drives them and how they function, we realized that an effective solution is going to be a solution that really moves the needle on testing. It's going to be a solution that unites and aligns the stakeholders and potentially eliminates the stakeholders that just can't or don't want to be aligned. And this solution at the time didn't really exist, especially for whole exome sequencing in prevention. So this is exactly the concept behind Panacea. We're not a lab. We are not a physician. We're not a genetic counselor. We don't need to be. There are incredible labs, doctors, GCs out there. What we do is we unite these vital stakeholders in a streamlined workflow that delivers immediate, uncomplicated access to whole exome sequencing, physician oversight, and expert genetic counseling without even needing insurance. And that's the one stakeholder we bypassed, in case you were wondering.
Right. Because
So
that's the biggest hurdle. Because if that wasn't a factor, I think so many more people, and my viewpoint is a little bit skewed in terms of just like Americans and our American healthcare system. But even in other countries, it is very hard to get whole exome sequencing ordered and covered by insurances, healthcare systems, all of that. So it's great. And it makes sense for people that are looking at this with a preventative view of like, I just want to learn as much as I can. I mean, when you think about, okay, $1,000, like that goes like that in an ER and MRI, like so many other things that is just like, part of healthcare. Like, so it makes sense of like, you're investing in your future, especially if you're, any point in life, I think it's interesting and useful, but especially if you're earlier on in life, I would think, because that can follow you.
Exactly. And it's a one and done. You're going to spend this $1,000 and you'll never have to spend it again because that data's there, and it's not changing, as you mentioned before. So it's really a valuable investment in yourself for sure.
So do you see insurance changing and starting to cover this because costs have come so far down? I mean, we're continuously seeing this in genetic testing in general. Even labs that I order for my patients, they recently, decrease cash price by $100. Like it's just constantly being reduced. So with that, do you feel like, I guess we'll stick to American insurance unless you know more about other global, but do you see that being a coverage, especially in the preventative space? Because $1,000 towards something that, you can prevent, or you can, like something like cancer. I can't imagine the bills that go with cancer that insurances have to pay for. Let's just look at it now, or other conditions.
So that's such a good question. It was one of the biggest questions that we also had as a company. This was another fascinating discovery, kind of like unraveling the insurance world. The insurance world, at least in this country, in the United States, is an incredibly complex beast, and they are, for the most part, for-profit companies. So their priority is their bottom line. So a very natural question is, why don't insurance companies cover preventative testing like genetic testing more widely, since healthier people save insurers money, right? It's a very logical question. Well, what we learned was that insurance companies actually have a very limited window of time in which they make money from their members, because they retain an average member for about 3 years. So it's only in that 3-year window that you are valuable to an insurer. So, for example, if you're a healthy 40-year-old and you aren't sick today and you aren't likely to be very sick in the next 3 years, it actually doesn't financially benefit the insurer to spend money on preventative care for you to prevent a problem that could arise 5, 10, 15 years down the road when you're no longer their problem. And
that's the key right there. You probably are going to have a new job with a new insurance company. So they're looking at just a couple years. They're not looking at the whole long term. Yeah.
Exactly. So you're no longer their problem, and you're no longer generating revenue for them. So this makes perfect financial sense for the companies, but unfortunately, it is not in the best interest of people. And this is exactly why giving people the opportunity to take control of their health by improving access to life-changing testing like whole exome sequencing is Panacea's mission, because no one is really incentivized to care about you more than you're incentivized to care about you.
Yeah, so that's a very good point. And loved ones too. I think there's, things of if you even looking at your children, once they're 18, I would recommend. I don't think we should be ordering this for children. But that's really helpful and important to have that information at that point. Did you know the same drug can affect people in different ways? Depending on a person's genetic makeup, some drugs may work more or less effectively for one individual versus another. Precision medicine has enormous potential to improve patient outcomes, reduce costs, heighten the customer experience, and, well, shape the future of healthcare. Let's Get Checked's newest offering for business clients, MyPGX, is a robust testing panel that identifies potential drug-gene interactions for over 100 drugs. Leveraging pharmacogenomic testing from Let's Get Checked can enable your doctor to choose the optimal drug and dosage and avoid the trial and error approach to prescribing, saving time and money. Utilizing MyPGX enables prescribers to select medications with greater expectation of efficacy and a lower risk of producing adverse drug reactions, benefiting patients early in therapy. Learn more in our upcoming episode with Let's Get Checked, exploring pharmacogenomic testing. Let's Get Checked also provides access to testing, virtual consultations, and medication delivery for a range of health and wellness conditions from the comfort of home. Use code DNA today for 20% off tests at letsgetchecked.com. Again, that's letsgetchecked.com with code DNA today. Let's dive into some of the examples because we've been talking about preventative health. I've mentioned cancer and used the BRCA genes as examples. Are there other examples that come to mind, other areas along with cancer where people can learn about these conditions in terms of that preventative health space?
Yeah, absolutely. So a whole exome sequencing, is an incredible diagnostics tool, but one could even argue that it's an even better preventative tool because spotting the potential for a really dangerous problem before it becomes a dangerous problem and then sort of having the ability to avoid or minimize the problems is really insanely powerful. It's literally like having a sneak peek into a crystal ball, right, of your potential future and then being able to make changes today that alter your path towards a more favorable outcome. It's truly mind-boggling. But the two biggest killers in the Western world are cardiovascular disease and cancer. And fortunately, or really quite unfortunately, these issues can have strong genetic origins, right? So far, science has uncovered genetic links to a lot of conditions, a wide variety of cancers, kind of as you mentioned, anything from breast to ovarian to colon, thyroid, and actually several cardiovascular conditions like various aortopathies, which impact the function or structure of the aorta and can cause heart failure, and various cardiomyopathies. And some of these findings are literally life-saving. So, for example, many aortic problems are completely asymptomatic. So you don't even know that you might have a problem. And a lot of these issues are uncovered by accident in a lot of people. And sometimes, unfortunately, these problems aren't discovered at all until it's too late. So genetic testing would essentially save the life of an individual with a congenital aortic abnormality. And the good news is that a lot of stuff can be done about aortopathies and a lot of other things that are found through genetic testing. They can be treated with medications, more frequent screenings, lifestyle changes, and even surgical intervention as well. And just to share a little tidbit about me personally, my whole exome test revealed that I actually have a RAD51D mutation, which puts me at higher risk for developing ovarian cancer. And not shockingly, my sister got tested and revealed she has the exact same mutation. And there are a lot of preventative measures you can take with an increased risk of ovarian cancer. So I'm incredibly thankful that I have access to this information so that I can be in control of my health. So it's really incredibly impactful, or it's incredibly impressive how impactful whole exome sequencing can be for prevention.
It really is. And I think you highlighted the two areas that I think of first when looking at preventative health of cancer, which I think a lot of people are aware of, they know about. That's not necessarily news, especially for a lot of people listening right now. But the cardio side, that's something that doesn't get a lot of attention. And as you said, a lot of times we're learning about these genetic variants, pathogenic genetic variants, so mutations, post-mortem. So after someone has died from sudden cardiac arrest, and sometimes they're really young. And when we see that in a family history, that's when we say, well, everybody should get tested. But oftentimes, sadly, that event has to happen for other people to be tested. But
I know.
now we know that that's not the case. Like, many people can afford $1,000 test that could potentially save their life. I think especially if they have family history where maybe panels came back negative and we just don't really fully understand yet, or, that gene is still being debated whether it should be on a panel or not. And it's like, well, just skip the panels and go right to Exome, I think, when it comes to preventative health. Yeah.
Exactly. Actually, one thing I should probably add is you can use FSA and HSA savings accounts for genetic testing.
And that way it's tax-free, right?
Yes,
From what I'm learning as a, a budding adult here.
Exactly. So if this is something that, you're interested in doing, you can certainly use that to help fund this potentially life-saving test. Absolutely.
Yeah. And there's an interesting study by the Mayo Clinic that's featured on your website, and that's how I learned about it, where they tested patients regardless of family history, cancer type, or age. And it revealed that the current standards for screening guidelines would have missed over 50% of patients with inherited cancer mutations. 50%.
Insane.
So that's crazy. And we've talked about, even on our recent episode, our NSGC 2022 recap, that was episode 212, where we talked about, the NCCN guidelines have been updated again. And now it includes, I want to say, all people with colon cancer to have testing, but I hope I'm quoting that right. Okay.
Yes, I think so. Yes.
So, I mean, there's just so much, it's hard for me to keep up with the cancer space since I'm not actively working in it. But I mean, do you predict that more people, as they are doing whole exome sequencing for preventative reasons, it's going to affect guidelines to be more inclusive so that a lot of these 50% of people will be recommended to have testing? Like, is it going to work backwards in that sense?
So that's a fantastic question. And this was a phenomenal study, actually. It was sort of groundbreaking.
Yeah. I mean, anything Mayo Clinic, it's going to be. But...
Exactly. We had the honor of speaking with Dr. Joel Samater, the lead investigator in this study. And the findings really were just incredible. And it was so amazing to be able to discuss it with him. The INTERCEPT study is the largest cancer genetic study ever conducted. And what resulted was that 1 in 8 people with cancer had genetic links to cancer. And that number is 4 times what we had originally thought, right? So our understanding of the role of genetics and what the role of genetics is in disease development is really expanding. And as you pointed out, the current guidelines would have left out half of these individuals, right, out of qualifying for genetic testing, which is astronomical. So to answer your question, yes, I do think and hope that with more people getting whole exome sequencing for prevention and the more data that comes off of these tests and the growing body of irrefutable evidence, that the guidelines will evolve and expand to include more people. You may remember a study a while back done by the Queen of BRCA herself, Mary Claire King, where the study actually showed that 50% of people with pathogenic BRCA mutations actually have no family history of breast cancer. So the guidelines, have excluded a lot of people for a long time, but I think the more and more evidence that builds, the more and more flexible and expansive the guidelines will become.
And I want to say Mary Claire King has been one of the proponents for everybody, like population testing for BRCA. So I think that's, very much fits into this conversation, but, expand that even more to just the whole exome. But that whole concept of like, it is worth it now. It's gotten to a price point where it is worth it financially.
Definitely.
And we've talked about the cost changing over time, and it's really exciting that now this is something that's affordable, that through you guys, $1,000, and people can have this information and also have that physician oversight, genetic counseling. We've talked about what has inspired you to start this project really in this company. I want to know a little bit more about the specifics of the actual testing for the total nerds listening. the typical questions that genetic counselors ask, like what is the depth of the testing? What's the turnaround time? How does that compare to the industry standards versus what Panacea offers?
Sure.
Just to get those like questions that are on people's mind. Like, Kira, why did you not ask about this?
Sure. So, great questions. The depth that we have through our partners at Gene by Gene is 80x, which I think is quite a bit higher than most whole exome tests. I think they're usually around 30x. So we're just at 80. And then regarding the turnaround time, what I've seen typically is 4 to 6 weeks is pretty standard. Panacea's turnaround time with Gene by Gene is actually really fast. It's 14 days from the moment that the sample arrives at the lab. So our partners at Gene by Gene are magicians. They're not even scientists. It's like Hogwarts over there. I don't even know how they do it.
I love it. I need a tour.
Yes, exactly. Go to Texas.
That is remarkable. I remember, I think you sent me an email about it or something, and I reread it, and I was like, oh, did I read that wrong? Because it was so fast. And I was like, what?
I know.
That's crazy. And as a genetic counselor, part of, as listeners imagine, I'm vetting people that are coming on the show, making sure that this is something that I can put my name behind and everything.
Sure.
And so one of the aspects that I really look for in companies is that they offer genetic counseling as part of the workflow. I think that's so important. How does that work with Panacea? If someone orders the test, can you walk us through a little bit of like how that works in terms of the physician oversight, the genetic counseling?
Sure. So this was an essential piece for Panacea. We knew that ethical and quality clinical genetic testing has to involve genetic counseling and, of course, physician oversight. And so not having that as part of our workflow and our offering was just an absolute non-starter. So it's pretty simple. As soon as someone purchases a test on our site, they can literally, in that same session, book a virtual meeting with our partner genetic counselors to review their test results when they actually come out. And this is actually included in the test price. It's not an extra cost. And we really wanted to make sure that it really was just a package fee. We don't want to, piece out and nickel and dime people for this incredibly important piece of genetic testing. We also offer the ability to schedule a virtual meeting with a counselor before you purchase a test. If you have questions or you want to discuss anything in particular before you sort of make the decision to purchase a test. There is a small fee for that, but it is, extremely affordable when you compare, of course, to other prices. But really, Kira, the overall goal is to provide a completely swift but expert guided experience for people, because that just doesn't exist. It really doesn't exist in the direct to consumer space with clinical testing, especially whole exome. So we're really happy about that.
Yeah, that is awesome. And right now, you guys recently launched. So right now it's available for people that have a place of residence in Florida.
Right.
And you guys have been really generous to offer our listeners 30% off. So that's $300 if I'm doing my math right.
Yes, exactly.
So people can use code DNA today at panacea.com, and we're going to have that link in the show notes. But what's also really cool is you guys were partnering up for a giveaway. So people can head over to our social media at DNA Today Podcast on all platforms, and enter to win one of these kits, and also, as you mentioned, all the other steps to that as well, that's involved. So thank you for offering that to listeners and everything. I think it's really exciting. Like, people listening are probably like, I want to know, like, what are my results with this? Is there anything that I can do to help my health and my loved one's health, in that prevention space? Because prevention is always going to be better than treatment.
Absolutely. We're so excited to be able to offer this to your listeners, and 30% off is actually the lowest this test has ever been, and it's just gonna be around for a little while. So take advantage of it now. Excellent Christmas gift for yourself, for your family, for your loved ones. And we're so honored to be on the show today talking about it and doing this with you.
Yes, I had to make sure the tree was in the shot for people listening on YouTube. So that was in the back of your mind, like, ooh, Christmas gifts, holiday gifts.
Exactly.
For people that may have birthdays around this time. But yeah, I think this is a really, really interesting and different type of gift to give someone, and have
It
that
is.
just being armed with medical information. I'm certainly one that thinks knowledge is power, and I think it's good to have this information ahead of time, because a lot of these conditions that can be identified, as you said, can be treated, prevented ahead of time. So,
Yes.
it's not going to be every condition, but I think those are the ones to focus on, and like what to drive people to be doing whole exome sequencing. And also, if you're just a nerd and you just want to have this data, I mean, it's just so cool. Like, I've been doing the show 10 years, and it's really cool just to see in that 10 years, like how much has changed in terms of, I wasn't talking about whole exome sequencing in 2012. Like,
Exactly.
it existed, right? I think,
Exactly.
but
It did,
it wasn't
yes.
something that everybody could access.
Absolutely. And it was unaffordable. It was
Yeah.
just unaffordable. So, and that's not really the case anymore, especially, with Panacea and our partners. We're just doing our absolute most, to keep this test accessible and affordable. So it's possible now.
No, it's a fantastic goal, and you're achieving it, and people can access this now. And I'm excited for people, your next phase, more states,
Yes.
the United States, other countries. I mean, just the possibilities
Exactly.
are endless here. And it's just great that it's this direct consumer model, but it's physician assisted. So it really
That's
is
right.
both. Yeah.
That's right. Yeah. That's
Yeah.
important to point out. Thanks for pointing that out, Kira.
Of course. Yeah. Well, thank you so much for just letting me nerd out for a while about whole exome sequencing and preventative health. It was just great to be able to chat with you, especially with this busy time around the holidays. So thank you
Absolutely.
so much for coming on.
No, thank you for having me. This was super fun.
For more information about today's episode, visit dnapodcast.com, where you can also stream all episodes of the show. We encourage your questions, comments, guest pitches, and ideas. Send them all into info@dnapodcast.com. Search DNA Today on Twitter, Instagram, YouTube, Facebook, so you can connect with us there. And a favor, please rate and review the podcast on Apple, Spotify, or wherever you listen. This truly helps us climb the charts and allow more genetic nerds like yourself to find the show. DNA Today is hosted and produced by myself, Kira Deneen. Our social media lead is Corinne Merlino. Our video lead is Amanda Andrioli. Thanks for listening, and join us next time to discover new advances in the world of genetics.
The genes of you and me, the genes of you and they're all made of DNA. We're all made of the same chemical DNA.